with a lot of germs. And that is what I was talking about. You have to identify the germs breeding areas. Can you give me an example of germs breeding areas? We can talk of door knobs, isn't it? Door knobs, isn't it? How many people do you think they hold this door? So many, isn't it? Yeah? What else? Washroom. The place where there are so many germs, isn't it? Washroom. Yeah? What else? Money, isn't it?
Objects.
Objects like
Pen.
phones, isn't it? Yeah? Food, like fruits, isn't it? You can imagine when that food comes all the way from the farm to the shop, isn't it? They have gone through many processes and in the hands of so many people, isn't it?
Yeah.
So that means when you buy fruits, you have to like properly wash them, isn't it?
Yeah.
Yeah. So you have to identify where the germs may be coming from, isn't it? Yeah.
Yeah.
Soiled clothes, isn't it? Soiled clothes or dirty clothes can be contaminated, isn't it? Huh?
Yeah.
So you have to identify all these areas where the germs are coming from. Welcome, Sean. Okay, so we are saying that contamination is an area or a thing with a lot of germs. Even switches. How many people touch the switches? So many, isn't it? Yeah, isn't it? Yeah? Sometimes people put towels in the washroom. Think about how many people use the washroom and they wipe themselves with the same towel, isn't it? That be contaminated, isn't it? So contagious, the meaning of the word contagious means easily spread. Easily? The germs can easily be spread from one person to another. So when you go and change dirty clothes, you're supposed to put on protective equipment, PPE, isn't it? Personal protective equipment. Yeah? You're supposed to put on gloves, isn't it?
Yeah.
That also helps you. Never reuse gloves. Alright? You're never supposed to reuse gloves. So, disinfecting is using bleaching solution. Using bleaching solution or another disinfectant or another disinfectant to kill germs. That's why when you report to work, you're supposed to disinfect, isn't it? Yeah? Isn't it?
Yeah.
Because you don't know how many people have touched these doorknobs, isn't it? Yeah, you don't know how many people who have touched them. Immunization is a medical treatment. This is a medical treatment. It's a medical treatment given to protect from a certain disease. It's given to protect from certain disease. Yeah? Like BCG, tuberculosis, isn't it? You are given so that it can protect you from certain disease. Immune system. When you talk about immune system, you are talking about a collection of cells, a collection of cells. This is a collection of cells, chemical messengers, and protein that work together to protect the body against what? Pathogens. Against pathogens. Pathogens, this is a fluid-related diseases, isn't it? Like HIV, which is contacted through blood, isn't it? Or fluids through the body. So these are some of the things that we are talking about. So when it comes to practicing what we call international standard precautions, this is about glove removal and washing of hands. I've said before, before you put on gloves, you have to wash your hands, isn't it? And how do you remove gloves? And all of you come here and stand here and practice. So what you're supposed to do, you're not supposed to touch the edges of the gloves, okay? You're not supposed to anywhere touch them. So what you're supposed to do if you're removing gloves, I think these ones of mine are oversized anyway. We're gonna use them anyway. So my left is stronger than right, so I don't have to use a particular hand to remove the glass. Okay, so you're supposed to pinch. You pinch, okay? You pinch, then you pull. Don't remove yet. You're gonna come and demonstrate here. Okay? So I've already removed. Then get 2 fingers from the inside without touching outside. Then you peel inside out. That's how you remove. Okay? You're no longer touching, you're nowhere touching the gloves from outside. Okay? Just come and remove yours. See. So demonstrate to us.
How are you, everyone?
Why are you not responding?
Hello, everyone. Hello, Jay.
Now you become a teacher. 1 minute. Continue.
Okay, this is what we are supposed to do. You grab here.
Yeah.
And remove. You hold like that. You take the two fingers inside and remove the other one.
You peel. Can we clap for her? Okay, Gina, your turn. It's very important to know how to move.
Hi.
Hello.
So you're not supposed to
Can
touch
you
the
introduce
edge.
yourself?
I'm Sabrina.
Nice to meet you.
So you hold this part,
You peel.
you peel, you hold this way, you take the 2 fingers without touching outside, and here we go.
Inside out, okay?
Yes.
Yeah. Okay, alright. Good, let's start up. Sean. Yes. Glove removal.
So you said you pinch. Hello, everybody. My name is Sean.
Hi.
So you said you pinch this.
Yes, we are doing like this.
Well, I'm showing you.
Yes, I know we lift hands when we are putting on limbs, but we are removing grass. Okay.
On the 2 fingers.
You see that's a problem. If it falls during the state exam, you're gonna fail the exam because you're causing contamination. That's why you're holding. It is inside out, isn't it? So it should not fall. Okay, it's okay. But anyway, we'll continue practicing that shot.
Okay.
Okay, all right.
What do I throw this?
Ollie, just hold on, then we're gonna throw it. Okay, Ori.
Hello everyone, my name is Oli. I'm just showing you guys how to put my blood out. First of all, go here. Okay. Then put my 2 fingers.
Good. If it falls, you
Yeah.
fail. Okay. Just make sure it doesn't. Okay, just you throw it.
Okay.
Okay, just make sure. You make sure the glove doesn't fall. Contamination. Remember, we're talking about prevention of contamination.
Hello everyone, my name is Isa. This is how you remove your gloves, huh? There's pins somewhere there. Peel it out. Hold it like that. Put your 2 fingers there. Like that. And then
Yeah, and of course you dispose your appreciate him now. Of course, after removal of gloves, what else do you do? You dispose, then wash your hands, isn't it? Don't forget, every time before you put on gloves, wash your hands and you dry them thoroughly. Because if you don't dry them thoroughly, then what is going to happen? You have problem trying to put on the gloves. So dry your hands properly, put on gloves, okay? And then after you're done disposing your gloves, wash your hands again. That is the procedure, no shortcut. Don't use gloves for one client to another client. So if you are from changing client A, okay, or helping or assisting client A from room A, and you're going to B, what are you supposed to do? Remove the gloves that you've already used, isn't it? Wash your hands, put on new gloves, go and help. From B, remove the gloves, wash your hands, put on new gloves, help C, like that all the way. Don't use gloves. Okay?
Yeah.
Are we together on that one?
Yes.
If you fail hand washing and gloves removal, you're not going to continue the exam, or you will fail automatically. So that is a very serious thing. When it comes to hand washing, proper hand washing, you're supposed to open water from the faucet first. Check the temperature, isn't it?
Yeah.
Even if when you're giving client a shower, whether it is a sponge bath, you're supposed, first of all,
Yeah.
let them feel the temperature of the water. Ask them, isn't it? Yeah?
Yeah.
Ask Mrs. John, I want to give you a sponge bath. Is the temperature of the water okay? Yeah? If you say, hey, it's too hot, you try to add some more cold water. Yes, I like it that way. You are confirming. Even you always check.
Yeah.
You wait for water to be warm enough, isn't it? And then from there, then you have to observe their privacy. If you are moving them from their room, from a bedroom to the washroom, you have to make sure you cover them with a gown, with a shower gown, isn't it?
Yeah.
Isn't it?
Yes.
Even us in the house, whether we are alone, we cover ourselves going to the washroom,
Yeah.
isn't it? So, and I say this, that these are grown-up people, and they have to deal with the fact that there is someone who is helping them, and we are used into doing these things for ourselves in the private, without somebody seeing what we are doing. So you have to deal with that. In fact, give them space. Make sure you cover them. Don't just uncover them. Make sure the windows are closed. The door. You cannot change the client and the door is wide open and you are undressing them. Even if you don't undress yourself in the open, isn't it?
Yeah.
You make sure you close, and if somebody knocks the door, you say, hey,
Yeah.
give me 2 minutes, isn't it? Why do you ask for a minute? So that you can cover yourself, isn't it?
Yes.
But why do you want just to, you are undressing them, you are transferring them from the wheelchair to the bed, and the door is just open, everybody passing can see them. It is not right. They have right to privacy, isn't it?
Yeah.
So make sure that you try to give them the best privacy that you can give them. So when we talk about infection control, is trying to stop the spreading of germs, isn't it? Trying to stop the spreading of germs. You're trying to stop, and that's why we are wearing masks, isn't it?
Yes.
So that we do not pass corona from one person to another, isn't it? Yeah?
Yes.
So virus, what is a virus? Virus is the smallest. Virus is the smallest living organism that causes disease. Smallest living organism that causes and we have to protect ourselves, of course, from all these so that we can be able. So, can we talk about conditions that make germs to spread? Five conditions that cause germs to spread. 5 conditions that cause disease to spread. Number 1, moisture. Germs grow faster in moist areas. They grow fast in moist areas, okay?
Yeah.
Heat. Germs multiply. They multiply fast in warm areas. The other condition that also makes germs to grow is air. Air. Most germs need oxygen. They need oxygen in order to grow. Most germs, they need oxygen in order to grow. What's the other condition? Food. Food. Germs need food. They eat as we eat, isn't it? They also need food in order to grow. Germs need food in order to grow. And then the other one is darkness. Darkness. Germs need darkness. Germs need darkness or absence of light to grow. So So these are 5 conditions that encourage germs to spread. So and once you identify, then you are aware, or you're in a position to know how cold you're supposed to preserve